in the skills lab, they're labeled as practice, and there's like 2 different patients you can pick from. So there's an antiseptic and an Alzheimer's patient, okay? So we're gonna give you one of these. You're gonna have that, you'll have a MAR, and then you're gonna have your injection pad. So this will be for your IM injection, and then we're gonna have this little guy, and that's for sub-Q and intradermal, okay? You'll also have, a little, I'm gonna call this your AccuDose, okay? So that will be your little AccuDose where you're gonna pull your meds out of. And then you're gonna have your medications in there. What else? So the first thing, gather information pertaining to the ordered medicine. So that is your med paper, right? So that's your med paper that has all your meds listed with the indication and your med names, your brand, your generic, why it's ordered, what this ordered dose is, and what a safe range is. Make sure you fill that out, okay? Routes, if they can have it PO, if they can have it IM, if they can have it different routes, I want you guys to write them all on there so that you know that it comes in different routes, okay? And then frequency, how often it's ordered for that patient. So we'll have that on the MAR, but on the example things too, I don't think, it doesn't have a frequency. You could just write how, like what a safe frequency is, right? So if they're allowed to have it every 4 hours, you can write that. Or if it's like every 6 hours, you can write 4 to 6 hours, whatever a safe frequency is, okay? And whatever the safe dose is. So that's gonna be your information pertaining to ordered medication. You're going to demonstrate the correct sites for subcutaneous, intradermal, and intramuscular injections. Again, I typically do that at the end after we've gone through the other stuff, but that information is in under the modules that I gave you guys. So you can look that up. You can look it up on YouTube. You can practice on one another. That's the best thing to do, is to touch one another, because it is tricky on some of the spots to find it. So it's easier to do it in real life, because you're going to be doing it on us, okay? Because we're going to stand up and say, show us that location. And then again, the intramuscular injections, we're not doing the dorsal gluteal. We're doing the ventral gluteal, the deltoid, and then the vastus lateralis. So just those 3 ones, okay? Obtain the correct size syringe and needle for type of injection. You're gonna have your needles that are out, and you're gonna have the ability to pick the size for your patient, right? So we need to make sure, we don't want you to pick, an IM needle to do a sub-Q injection. We don't want you to pick an IM needle to do an intradermal injection. So you have to pick that appropriately, okay? Calculations as needed for administration. You can just have a pen and a paper with you. It's the same math you guys are going to do on the math test, but honestly, they typically come already done for you. So I wouldn't worry about that. But and by this time, did you guys do the math test yet?
Next week.
Next week. Okay. So yeah, it's going to be the same type of math. If we were doing math, it would be the same as on the math test, but I wouldn't worry about that so much. We just want to make sure you know how to do that, but that's what the math test is for, right? So you're going to be, if that was needed, you would know how to do it. Ampule, so tap the top of ampule. I'll go over how to do aspirate from the ampule, but these are the ampules, okay? I for sure will plan on having you aspirate from an ampule, just because the practice of breaking it, and then I for sure will have you do a Z-track method. Okay, like I said, so no surprises. Rotate the vial between palms to disperse the medication, remove cap. Okay, we'll go over all of that stuff. Apply clean gloves. Okay, so, and again, most of the stuff, cleanse site with alcohol. Obviously, if you're going to be doing an injection, you need to clean the site, right? We also expect when you're aspirating medications from a vial that you're cleaning the site, prior to aspirating. Z-track method, I'll show you what I want with that. If giving IM, aspirate. If I'm not mistaken, and I will correct myself if I'm wrong, but if you're doing a deltoid injection, you do not need to aspirate for IM. We used to. It doesn't hurt to do that, but I guess the new teaching is that when you're doing the vastus lateralis and the ventral gluteal, you're still supposed to aspirate, because those are in larger muscles, but in the arm, last semester we were telling people they did not need to do that. So, and then we want to make sure you're injecting slowly, that you're waiting the 5 to 10 seconds before you withdraw the needle. And then it says placing alcohol pad on the skin. You're going to have little gauzes instead that you can put there if there's any type of blood or anything like that kind of comes back. But otherwise, hopefully there isn't. And then you're going to want to do a Band-Aid on your IM injection. So we'll go over all that. And then activating the safety feature, assisting to safe position, we'll go over all that. Equipment, discard gloves, record on the MAR, return within 30 minutes, and then notify prescriber. Okay, so we'll go over this stuff. All right, so like I said, you'll have your order here. So the very first thing, people will say, oh, I'm gonna start my first check, and then they say, oh, I'm looking at this and I'm verifying it, you know, or I'm checking it against the MAR. But this, you cannot perform a medication check with no medication in your hand. So when you're verifying, because we're going to call it verifying, your MAR against your doctor's order, that's just verification. Okay, so when I say like, when I wrote in that announcement, that's one thing that I say, and then people will say, oh, I'm doing my check, but it's not a check because there's no meds in your hands. So you can't do a check. But what you can do is I expect you to go there back and forth. So you're gonna see that you have your patient's name, right? You see your patient's MRN, you see your patient's, oh, thank you, date of birth. You see the physician's name. There should be a date on here too and a time, but it doesn't have it on here. But so basically you're verifying that the information on here is the same information on there. That's your first step, that's verifying. And I want you to go through that. So how that looks is, I have an order for Mr. Alzheimer, MRN 123456, MRN 123456, date of birth 12/12. There's no year on here, but 12/12 XX. We have Dr. Michael Moore. Dr. Michael Moore signed here, initial, there should be a date and a time. Okay, so that's all good. Now I want to check my orders, right? So Lovenox, somebody wrote heparin. I don't know why they wrote heparin on there, but Lovenox 30 milligrams subcutaneous daily, right? So I have Lovenox 30 milligrams subcutaneous daily at 9 a.m. Okay, so that verification checks out. Then you're going to say the same thing on morphine. I have morphine 10 milligrams IM Q6 hours PRN for pain 7 to 10. Morphine 10 milligrams IM Q6 hours PRN for pain 7 to 10, and so on and so forth. That is the verification. Okay, after you've done that and you made sure that both of those information is matching and the same, you don't need this part anymore. This is going to become your EMAR. Okay, so when you're doing your checks, you're going to be doing them off of this. Okay, so that will, I just attach them and keep them aside because it's hard for the students to look at both and go back and forth like that. So now we have our MAR here. Okay, so after I've done that, then the next step that I want to do is introduce myself to my patient. If I'm giving pain meds, what do I need to know? Pain level, right? And then you have to do your whole pain assessment, right? So you have to know like, where is the pain? What is the pain level? What does it feel like? There's a whole,
vital signs.
Yeah, vital signs, yes. So all of that stuff, right? So I know as a nurse that I'm gonna need to go and get that information before I give the morphine. I'm not just gonna walk in with morphine, randomly. So Lovenox, so that's fine. And then if we were giving insulin, then we need to know what the blood sugar was, right? So we need to know how much we're covering, right? And then this guy has like a COVID vaccine. But again, I'm just going to have you guys do 1 IM. I'm not going to tell you which one I'm going to pick. I'll probably change it up between, different students. But because there's 2 IMs on this one, and I really just want you guys to do 1 IM, 1 sub-Q, 1 intradermal, okay? So that being said, now what I would do is I don't need to get my medications prepped or anything just yet. I need to go see my patient because I need to see what my patient looks like so that I can see if I have a big, burly, thick gentleman who needs a longer needle for an IM injection, or do I have a little, frail 75-pound-year-old, or 75-pound 80-year-old, right? So that's why you need to go and assess your patient, right? So what that looks like is after I have my MAR or whatever, I'm going to go in and I'm going to do hand hygiene. And I'm gonna say knock knock, and I'm gonna walk in the room, provide privacy. Okay, so I did my hand hygiene, I knock on the door, and then I'm gonna introduce myself. Hi, Mrs. Smith, my name is Jennifer, I'm gonna be your nurse today. Can I just verify your ID band? Okay, your patients are gonna have a little ID band. Now that I say that, there's not one in here. There should be a little ID band. Usually I just set it on top of the little pad, and I'm like, there's your patient. Okay, but so there'll be an ID band that's missing out of here, but I'll make sure you have one.
So like this,
Okay.
yeah.
Okay.
So it'll have like name, like a wristband, yeah.
Okay. So I don't need to put gloves on walking in this room because I'm not doing anything to this patient yet other than introducing myself and making sure that I'm verifying who it is, right? So I did my hand hygiene, I knocked in, provided privacy, I introduce myself to the patient. Hi, hi, Mrs. Smith. My name is Jennifer. I'm your nurse today. Can I just verify your name and birthday? Okay, and then we'll probably talk back to you and be like, Mrs. Smith, my birthday is blah, blah, blah.
Yeah.
Or Mr. Alzheimer's or Mrs. Antiseptic or whoever your patient is, right? So we'll verify that with you, okay? And then what do we ask patients? Allergies, right? Okay, can I verify if you have any allergies? Okay, no allergies. Well, I just want to let you know the doctor has prescribed some medications for you today. So there is some Lovenox that he ordered, and that's to help prevent any blood clots. Do you have any issues with me giving that to you today, right? So we're providing education, and we're making sure the patient wants it, right? Because sometimes you'll go into patients' rooms and then they're like, well, I don't want this, and I don't want that, and I don't want that. And there's no point in prepping all of them if they're gonna not want it when you go in the room, right? So we're assessing the patient, we're seeing that 2, is morphine appropriate? If you walk in and your patient's obtunded or their respiratory rate is like 10, then it's probably not gonna get no morphine, right? So you have to go in to see your patient to determine those things though, right? So, okay, so the doctor ordered Lovenox, is that okay? Oh yes, that's okay. What's that for? That's a blood thinner. It's just to help prevent any blood clots when you're laying in the hospital. You're not as mobile and blood clots can tend to form, and we want to prevent any complications from that. Are you okay with me giving that to you? Okay, great. The next thing I'm going to have for you is morphine. The nurse before me said that you were having pain. I just want to verify that that's true and get some vital signs to make sure that it's safe to give that to you. Okay, yes, I have lots of pain. Can you tell me what your number is? It's an 8 out of 10. Okay, so then, while I'm talking, okay, let me grab some vital signs, and then can you tell me where your pain is and what it feels like and, what makes it feel better or worse, that kind of thing. Okay, so we do vital signs. We see the blood pressure, respiratory rate is good. She's given us a number on our pain scale, right? Okay, so everything looks good. So I will make sure to get that pain medicine. I'll get it prepped and ready, and then I'll bring it back into you after I exit the room and come back. And then we also have insulin. Oh no, we wouldn't do insulin. We wouldn't do insulin because we're already doing one subcutaneous thing, right? Because we're already giving the Lovenox. So let's say we're gonna need to do the TB test, right? So PPD. I know for sure you're gonna have PPD on your practice one, so I'm just telling you guys ahead of time. And that is one of the meds, I believe.
Yeah.
Yeah, you guys look up, right? Okay. So we also ordered, the doctors also ordered a tuberculin skin test. That's just, let's say, maybe she's going to a sniff, or sometimes if somebody's starting on dialysis and they're going to go to a facility for that, they have to have that cleared before they start, right? So I can say the doctor also ordered a PPD or a TB skin test. That's just to make sure that everything is clear before we send you off to Brookside and today, or in 2 days. So I'm going to go ahead and get that prepared for you as well. Okay. All right. So I've explained to my patient what I've given. I've checked their vital signs. I've gotten their pain level, right? So now I'm going to excuse myself from the room. So, okay. So I'm going to go ahead and get those ready. So I will come back and see you shortly. Okay. So hand hygiene, exit the room, and now you can go and start pulling your meds. Okay. Makes sense? All right. All right. So now we'll move on to the AccuDose, right? So I did my hand hygiene when I exited the room, so I'm going right over to the AccuDose, and I'm going to start pulling out my meds, okay? So our first med on our practice for Mr. Alzheimer is heparin, or no, sorry, Lovenox. Why did I have
I'll cross it off.
I don't, do you have,
Or I don't know.
I just need a, it's fine. It's just confusing me because somebody wrote that on there, and I don't know why. Because heparin is not Lovenox. Okay, they're different. So that being said, so Lovenox, so I'm going to go over to my AccuDose, and I'm going to start pulling my meds. When you guys do the oral meds and stuff, like when you're in the nursing program, it's the same process, right? So as you're pulling the meds, you start doing, so I can go over and say, I'm going to start pulling my meds now and begin my first medication check, okay? So we're going to pull out, we have Lovenox, 30 milligrams sub-Q daily. Okay, so I pull that out. Okay, so I have Lovenox. Lovenox always comes pre-filled. So if you guys have ever had any experience with Lovenox, it comes in a little syringe that has an air bubble, and that air bubble is supposed to be there. Don't take that air bubble out. I had a nurse one time tell me they're supposed to take it out. I'm like, no, that's the sole purpose. You're not supposed to take it out. It's like a little air gap for your patient to make sure all the med goes in. So Lovenox comes pre-filled, but you still need to do your checks, right? So you still need to make sure that you have what? What are our checks, right? For the right patient,
right medication, right
dose, the right time, the route, right? We have to make sure we're doing those things, right? So I'll say, okay, well, I have Lovenox. I have 30 milligrams, which is funny because this is 40. See, But we're not gonna trick you guys, that you won't,
Yeah.
it won't be like that on yours, okay? But this one does not match, so, but let's say that it does. Okay, so it's 30 milligrams subcutaneous daily. It expires. I want you to say expiration, right? So just get in the habit, even when you have like pills and stuff like that, just saying that, like, so it expires, 7/35. It's for Mr. Alzheimer's, MRN or date of birth. And it's for 9 a.m. Okay, so this looks good. It's labeled over. So I'm going to give you guys a kidney basin because I like to put my meds all in a little thing rather than like, if in reality you need something to put all your meds in, right? So I put that there. Now I'm going to pull out my other med, looking for morphine, 10 milligrams, IM Q6 PRN for pain 7 to 10. Her pain was 8 out of 10 in her hip. All right, so now I'm pulling it out of my Acudose. So what do I have? Morphine, 10 milligrams per 1 ml. And then I'm going to be giving 10 milligrams. Now, these say 10 milligrams per 1 ml, but it's going to be 2 mLs in here. So you guys are going to have to draw up and you don't have to waste and stuff like that. It's not a trick. It's just that's what size the vials come in too. So just make sure you're doing that. So I have morphine, 10 milligrams per ml. It expires 7/35. So, okay, I'm doing my 5 checks, right? So do I have the right patient? Do I have the right dose? Do I have the right route? This one's going to be IM. Do I have the right time? So what do I need to know if I'm giving a PRN medicine too? Like, I need to know when the last time it was given, right? So if this is PRN every 6 hours and she got it 4 hours ago, then I can't give it to her, right? So that's something you have to know too. So you would need to know that. But let's say that I'll give you a time. We'll give you time to make sure. So it's going to be within the safe amount of time. Let's say she got it 8 hours ago, so she's fine to get it. Okay, am I forgetting anything else? And then when you're looking at it, you want to make sure that your solution is clear. It shouldn't be cloudy. It shouldn't have anything in it, right? So verbalize that stuff to us so that we know that you're looking for those things that you can identify if a medication is not good, right? Okay, so I have that. Okay, so I'm going to do that. And then I'm going to get my other medication, which I don't think they're going to have it in here. Maybe it's I want the PPD, but maybe it's in the antiseptic. Isn't even on the MAR for antiseptic?
Yeah, it's not there.
Okay. So I'm not trying to mix my patient's drugs. I'm just trying to show you guys different injections, right? I'm gonna still put it. Got it? Okay. All right. So you'll have, this is not on the MAR here. It would be on her MAR. But so you would still do, again, the patient we're going to give you is going to have PPD. So you'll just verify, you'll do your 5 rights. You'll again make sure that you're checking the right dose, the right route, the right patient, the right time, right? And then you want to make sure the expiration date is still good. And again, you're going to verify that your solution is clear, that it's not cloudy, right? That it looks intact, right? And then the other thing is, anytime you're giving from like a vial like this, we want to make sure you guys are cleaning the top. Even if you just flip a lid off, we want you guys to make sure that you're doing that. Okay, so just get in the habit of doing that, even if it's a brand new lid that you just popped off. Okay, so we'll have that. Okay, so I have my medications now. Now I'm going to sign myself out of the Acudose, and I'm going to go over, I did my first check, right? I did my first check when I pulled my medications out of my Acudose. Now there's nurses standing behind me and they don't want to pull their meds, so I'm going to go over to my little prep area. And let's say I have my little prep area. You keep your medicines with you. You never leave your medicines, right? Leaving your medicines is the grounds for failing your sign off. So you don't leave your meds, okay? So keep your meds by you, and then I'm gonna go over to my little area. My sharps container, my gloves, my hand sanitizer. I'll put that there so you can see. All right. So usually the medications room have a med prep area. Like I think most hospitals have that. I know mine does. So med prep area should be a clean area, and we'll probably just put down like a little napkin for you guys because it's a clean area, right? And now you're going to begin your second check. During your second check is when you're actually prepping, drawing up the meds, and labeling your meds, okay? So you're going to go over and you have your paper, and now you're doing your second check, and you're going to do the same thing again. You're going to do your same 5 rights, okay? I know it's 7 rights, guys. I know that. I do know that. But remember that your reason and your indication is part of your very, very first check that I expect you to know before you even get the meds ready, and then your documentation happens on this, like at the very last, on your 3rd check when you're administering. So, and Anyhow, so you'll go ahead and you'll do the same thing again. So you're gonna do your 5 rights, and you're gonna do it with your, let's say, the Lovenox, right? And so we have 30 milligrams subcutaneous daily. We have the right patient. We have the right time. We have the right dose. We have the right route. And we have the right
time.
Time and route and expiration date.
But expiration is one of them, but no, patient, medication, dose, time, and route, okay? Right. So expiration is a part of it. I do want you guys verbalizing that, but it's not technically it's one of the checks. Does that make sense? So
Not one of the rights.
yes, exactly. So it's one of the checks you're doing, but so make sure you're verbalizing that, and then, make sure again that we're looking at making sure that it's clear, that our medication is intact. Like if you went to take a medicine out and it was open or the vial was cracked, then obviously you wouldn't want to use that, right? So you're checking, you're verbalizing that stuff. Lovenox is already pre-filled for you. So, and it's already labeled. So I don't expect you guys to label that medication, okay? But so now that's our second check. We're doing that one. But on these medications that you have to draw up, you're gonna have to label them because they're not labeled, okay? So let's say we move on to morphine. We're doing 10 milligrams in 1 ml, and we're going to be giving 10 milligrams, right? So we're going to be giving 1 ml, and then we're doing our 5 rights again. And now we can go ahead and proceed with drawing up this medication. We're going to prep the medicine, okay? When you have a glass ampule, there's a couple of things. One, you need to make sure that you tap all of the fluid out of this top here, which mine is stuck there. Come on. I got it out. The other thing you need to do is make sure that you're breaking. If you look closely, you're going to see there's kind of like a little scoring on the neck here. That's where you want to apply pressure. That's where it's meant to break, okay? And then the other thing you want to do when you're drawing up from a glass ampule, you want to use a filter needle, okay? So those are things that I expect you guys to do on your checkoff and to know, okay? So we'll go ahead, and again, you're going to have to pick the syringe that you want. Typically, like, I'm going to choose this syringe. It's kind of old, but typically they're going to come like this. You'll have like a needle and your syringe, and you just need to verify and make sure that it's an appropriate gauge and depth, like for your patient, right? So I'm just gonna use a 1-inch needle for my little lady. Let's say I have like a little old grandma and she's thin, so I don't need a big needle. But if you had somebody different, obviously you need to use a bigger needle if you have a bigger patient, right? So when you guys are picking, you'll pick, right? And the filter needle won't come in here. You'll have to grab it on the side. So let's say you open this. Let's pretend like it wasn't open. Important also, when you guys are doing the checkoff, you should not ever be touching this, right? And you should also not be touching this, right? That's dirty. Your hands, even though your hands are clean, like because you did hand sanitizer, you still don't want to touch them on stuff that's going to be, you're going to be going into a patient essentially. So when you're taking it out of here, your needle's going to be there. I just have people just kind of open it, enough to get that out. And then I have them leave their needle, this other needle part in there because it's clean in there. So, right. And then I take this out and I just carefully, I go ahead and attach my filter needle. Okay. So I have that ready. What else am I going to need to prep my glass sample?
Alcohol swab.
Alcohol swab. Okay. So exactly. So the way that I was taught and what I like doing in practice is I just tear along the border of my alcohol wipe and I put the neck of my ampule into here and I clean before I do it and then I snap. Okay, so you guys are free to do that as well. If not, you could take the alcohol wipe out and do it, but I think this is thicker and less likely to cut you, so that's the way that I do it. You could also use gauze if you want to, but I just personally feel like the alcohol wipe is faster and more efficient and effective than going through and getting gauze and doing all that. But if you want to get a gauze, I don't care, that's fine, you can do that, but you have to clean with alcohol wipe beforehand. So, all right. So I have my filter needle, I have my ampule. I'm gonna put that in there and I'm gonna just like clean along the nape of the neck. I always forget how long it says for. I don't know.
I don't think it says on here.
Maybe, okay, so then. Oh, one thing that I forgot to mention too, when you guys are doing your vital signs like on your morphine, just make sure that your vital signs within the last 30 minutes, right? So if you took vitals like an hour ago, you're gonna have to redo it. So and then when you're in clinicals and you're doing like your oral meds and stuff, same idea. So if you're giving BP meds and you took the BP an hour ago, just expect that you're gonna have to do that again. So if you really wanna be on it, you can say, okay, professor, like after your checks, you can be like, this is what it was, and I'm gonna go recheck it before we give it, you know, right before we give it as well. So just, they wanna know that you know those things. That's the main thing.
Yeah, so it doesn't say on the ampule.
Okay, all right. I thought I had something on here. Sometimes I get it. I'm overthinking it. Okay, just make sure you rub it. Maybe we'll say like 5 seconds or so. Just a couple good wipes, okay? So again, you don't want to touch on here because you've cleaned it with alcohol, but you need to have pressure by the neck, right? If you have pressure up here and pressure down here, that's not really effective for breaking the ampule, right? So you want to have more pressure up towards the nape of the neck and towards the base right there. So if you do that, and it should be away from you. You should not be breaking it towards you. So away, okay? Away. So when you break it, I'm applying pressure and I snap it away. This is glass, right? So it needs to go in a sharps container. Oh, there we go. Okay. You don't have to put the whole alcohol pad in there, but you can put the glass portion in there, okay? And then that can go in the regular trash. Now I have that open. I don't want to contaminate it or anything like that, right?
Mm-hmm.
All right. So the filter needle, everybody kind of freaks out when they're aspirating this stuff, okay? Because it can be a little bit tricky. The idea is that we don't want you touching all over the glass ampule and contaminating your needle, right? When you're putting it in, you want to avoid touching the sides, really. So, and the reason for that is once you're in, like you can touch the bottom of it because the inside of it is clean, right? The inside is where the medication's stored. So that has not been contaminated. But if you're introducing and you're taking it and you're touching the outside and then you're putting the outside into the inside of your fluid, the idea is that you're contaminating your fluid, right? So that's why they're like, don't touch the fluid, don't touch we want you to just get in. If you guys are old enough to ever play Operation, it's like that, okay? You get buzzed if you hit the sides, okay? I tell people when they're doing it, I say put your elbows on it, on the table, because you're gonna be nervous and you're gonna accidentally touch things, okay? So I have my filter needle, I have my syringe. When you're giving a medication, anytime you're drawing from an ampule or a vial, like, and it's not a multi-dose vial, hi, sorry, I'm still talking. Feel free to add in, so too, if you see something, all right. You wanna make sure that you're drawing up the whole medication, right? We don't wanna leave narcotics and stuff in vials because there are people that can find those vials. Believe it or not, you can get into sharps containers. There are people that are desperate and they will do things like that. So I had somebody that was a paraplegic that climbed over from one bed to the other bed and was getting in the sharps container. I don't even know how he did that, but where there's a will, there's a way. So make sure when you have medications like narcotics too, that you're drawing up the whole dose and then you're appropriately wasting it, okay? So for drawing up, I like to put my elbows on the side here. I'm gonna sit down actually because otherwise I'm gonna mess myself up. Okay, so I have my filter needle. There's also a filter straw. I don't care which one you use, as long as it's a filter needle or straw. I feel like the straw is a little bit thicker, so I think that it's easier to do it with the needle. So you're gonna put it in there like the game of Operation, right? And again, at the very bottom, it's okay if it's touching the very bottom, but you cannot touch the sides. And then you're gonna aspirate, okay? And you're gonna just pull along the plunger, or hold the plunger part, right? I don't want you guys touching along this guy right here, because then the idea is that you're contaminating your syringe, okay? So you guys need to use the little end of the plunger, and you need to draw up all of your fluids, okay? So I have all my fluids drawn up, all right? So I have that. Now I have some air in there, but that's fine. We're gonna get rid of that. When you're recapping this, when you guys are doing that, you should have the cap laying on the table here, and then you should only be touching, I don't know if you guys can see me. I don't want you guys like touching down here. You're gonna poke yourself. So when you're recapping, after you've put that on, you can either do it like this, and then you can put it upright and then tighten it, okay? Or you can have it laying flat and you can swoop it in, and tighten it right there. That's fine, but just don't put your hands at the end because you're gonna set your guys' self up to get in the opportunity to poke yourself. So upright actually is probably the safest for you, and then just making it snugly secure on there. Now when we're doing our morphine, we're only giving 1 ml, right? But I have 2 mLs in here because that's what came in the vial. So I have to waste my medication, right? You're gonna have a little kidney basin. We'll probably write waste on it or whatnot. And you're gonna go ahead, and I like to get the air out. If you guys do not get the air out before you're wasting it, and then you have an air bubble, when you go and you turn it sideways, you're not gonna have the right dose. So you have to get the air bubble out before you invert it and turn it sideways, okay? So I get the little air bubble out, and then I'm gonna go till the 1 and waist. You can take this off if you want. Either way, it'll either come out the tip of the needle or the tip of the syringe. Just make sure you're not contaminating your spot there, okay? So I got my 1, all right? Okay. And then now, why don't I go ahead and put on the needle that I'm gonna use for my IM injection, okay? So again, I'm putting that on there. And now I need to label my medication, right? So I'm gonna get a piece of tape. Word to the wise, regular pens don't write on this tape. So if you guys have like mini Sharpies or something, that would be better, okay? So on there, and I like to write it while it's on the table. So I'll write what my medicine is. So I'll write morphine, 10 milligrams, and I can write, I'm gonna date, time, and initial it. So I'm writing the medication, I'm writing the dose, I'm gonna date, time, and initial, and then I'm gonna label on here. Okay, like this, okay? So that's how you're gonna have it on there, all right? Now I've done that, don't throw away this, because if you throw away this, how do you scan your medicine, right? In real life, you can't do that. You won't be able to scan it, so don't throw that away. So now I'm gonna have this together. So I did my 5 writes, I prepared my medication, and then I'm gonna keep my vial with me so that I can, scan it, okay? So I have that. And then my 3rd medication that I'm gonna give is my PPD test, which I don't even know how much I'm supposed to draw for that. Will you tell me what it says on the other patient? Does it say?
0.1.
0.1.
1 ml.
Okay. So you're gonna need to pick the right syringe again, right? So this is my PPD syringe, and you can see how there's like the different things on there, right? So I'm gonna do my second check with my PPD, right? So again, I'm going through my 5 writes, I'm identifying my patient, my medication, my dose, my time, my route, all of those things, right? And now I'm gonna prepare it. So let's say I'm gonna aspirate out of here. I flip my little thing off, I clean the top, just give it a good scrub, right? If you're doing a multi-dose vial, like sometimes you'll have patients that have like hydralazine IV or something like that, or you'll have like an insulin vial, you have to make sure that you inject air to compensate for what you're removing. So if you're taking out like 1 ml, you have to put in 1 ml of air. So, but for this one, like it's a PPD, you wouldn't have to do that on, but insulin you would have to do that on, okay? Maybe hydralazine, if you're doing a multi-dose vial, you would have to do that on. So and the reason for that is if you don't do that, you're gonna create a ton of pressure in here, and it basically like will try to make it so that it's hard to like aspirate the medication out. So that's partly why we do that, okay? So I'm going to, I'll just, for the sake of it, I'll inject my air in there. I've cleaned it, I'm injecting. I'm gonna aspirate, I'm gonna invert, and again, I'm using the bottom of the plunger. I don't wanna touch around, I don't even know, I always forget what this part's called on here, but you wanna use that little tip at the very end here to pull up your meds. Practice with this. It's hard when somebody's watching you to like not be nervous. Like I know it's scary, I know, that's why I want you to practice. So muscle memory takes over and you guys aren't bending your needle and touching all over everything, okay? So that's the point of the practice and the lab and all of that stuff, right? So you draw up your medication, okay? So that's fine. Now I'm gonna recap because I don't wanna leave my needle everywhere. So let's say I'll put that in there. This one is a little trickier to get on sometimes. So if I need to, that's why I said like some of them you pick up and you swoop it and it's easy, but sometimes it's like, oh, I'm having a hard time getting it on. So as long as you kind of like pick it up and start to do that, then you can just secure it on with your hand there. But again, now I need to label this medication, right? So just like the morphine, I need to label my medication, my dose, I need to date, time, and initial it, and I need to keep my vial so that I can scan that medication, okay? So I'm gonna do that. And these are my little prep meds, right? So now I'm ready for my 3rd and final check and my documentation of the meds when I go into the room to administer to the patient, okay? So I'm gonna clean my prep area, right? I don't wanna leave a bunch of stuff out. I don't wanna throw things away. And you're gonna need to bring stuff with you, right? So you're giving injections, so what are you gonna need to bring? Alcohol pads, maybe a Band-Aid if they bleed a little bit. Yeah, the gauze. I don't think I have gauze in here. I'll have gauze for you guys.
Did you need a marker for the TB test?
Yes, yeah. That's a good idea. Yep. Please mark your skin. People don't do that, and then it's really hard to find it like a day or two later. And you're like, oh no. So yes, thank you. You should circle your PPD location. Okay, so I have all my supplies. Why don't I just put them in here because this is my little bag of tricks, right? So I have my gauze, my Band-Aid, my alcohol wipes. I have my meds that have been labeled, and I'm gonna go in for my third and final check, right? So now I'm going back to Mrs. Smith's room. Knock, 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 you know. Hi, Mrs. Smith, it's Jennifer, I'm back. Let me put my medicines down. Let me do some hand hygiene. Okay, this one's not working. There it goes. Okay. I'm back with those medications that we discussed earlier. Did you have any questions or think about anything while I was out? Oh, no, okay, I'm good. So just a reminder, I'm going to be giving you that Lovenox, that's the blood thinner, to help prevent you from getting any blood clots while you're in the hospital. I also brought your morphine for pain. Did you still want that? Oh, yes, my pain's 8 out of 10 still. Okay, I got that for you, and we already did our assessment. Is it still in your hip area? Yes, okay, so she still wants the pain medicine. Her vital signs, we took them. Her respiratory rate's good. Her blood pressure is good. Her heart rate's good. All of her vital signs are stable, and she has high pain, so she's appropriate for that. And then I had that PPD, okay, the PPD skin test. All right, so I did my hand hygiene. I am going to put gloves on now. You do not need to put gloves on when you're prepping the meds. You just need to have clean hands, but when you go to administer the meds, you need to wear gloves. If you forget to wear gloves for your injections, that's something else that you would fail on, okay? So make sure that you're doing that, please. So you put your gloves on. And then can I just verify you again, Mrs. Smith? And Miss Smith's got her little armband on here, and she tells me her name and her birthday, and do you have any allergies? No, she doesn't have any allergies. Okay. Am I forgetting anything?
No, I think
That's it. Chime in if I'm forgetting anything. Okay. All right, so I identified her. So I'm gonna go ahead and let's do the IM first. So if you guys are in the back, I know it's gonna be hard to see the Z-Track method, but hopefully your video recording will do that well. Okay, so I'm gonna go ahead and give her morphine first, okay? And I'm gonna do my third final check, right? So I have my MAR, and I'm just gonna go ahead and do my 5 rights with my morphine. So again, do I have morphine, 10 milligrams. I'm giving it IM. It's every 6 hours. She got it 8 hours ago for a pain of 7 to 10. Her pain is at an 8. So I did my medication, my route, my time, my dose, and I feel like I'm forgetting something.
med, dose, route, time.
Patient, thank you, all right? Okay, so Mrs. Smith, right? Mrs. Smith, I verified her, I verified all of that stuff. Okay, so that's good. So I'm gonna go ahead and set that right here on my little prep thing. I'm gonna give that to her first, and then I'm gonna do my final check on my PPD reading, okay? And remember, guys, I didn't put the tape on here, but remember, just like the morphine, this will have to, anything you have to draw up, you have to label, okay? So make sure that you do that. Okay, so I'm doing my 5 rights. I have my PPD. I have 0.1 milligrams. It's intradermal times 1 for Mrs. Smith at 9 a.m. Okay, so that's good. I'm doing my third check on that medicine. And then I have my third and final check for my Lovenox, which, okay, so again, 30 milligrams subcutaneously for Mrs. Smith at 9 a.m. And again, when you guys are doing it, make sure you're looking at your expiration. So these ones are all labeled with that. And again, you're checking to make sure that your packaging is intact, okay? So I know it seems like a lot, but you're doing it 3 times, okay? So just make sure and verbalize to us, like, I'm doing my third and final check for this medicine. Like, I wanna make sure that you understand that we're doing the checks like that and that it is those 3 different steps, right? So please do that. Okay, so I did my final checks. I have my patient, I'm in the room. I kept my little vials so I can scan them so I can do my right documentation, right, when we're administering them. And I have my my alcohol wipes, my Band-Aids, all that stuff. So I have my patient right here. Let's do the Z-Track method for this one. So the morphine, we're gonna clean the area. What I was taught, what I'm going to teach you guys is you should start, where is the needle going to go? Right in the middle, right? It's not going to go, people get crazy all out here. You're not giving it right there. You need to focus on cleaning this and then do a spread out circle, okay? But you don't need to do a big area cleaning. I want to make sure you're cleaning the area where the injection is actually going, okay? So give a good scrub there and then just make a circle like that, okay? So I'll give that. Z-Track is a little bit tricky. The point of that is that you're trying to displace the tissues so that the fluid does not come back out of the path of the needle. So if you don't pull it over enough, then you're not going to do that. Also, if you don't let go at the same time as you're removing the needle, you're still leaving that path open and then your stuff is still going to come back out. So if you have like a medication that's kind of caustic to the skin or that's a large injection, like sometimes that's why they use the Z-Track method, and it's to help prevent it from coming back up and like irritating the tissues, okay? So when you're doing the Z-Track, you're doing it with your IM. So I have my morphine injection. And again, I've done all of my checks. I have verified my patient. I'm now gonna go over, you have to displace the skin. So I know my target area, I can see it on here. I'm gonna displace, I'm gonna slightly tug over. I'm right-handed, so that's how it's gonna look for me. I'm gonna slightly tug over to the left, and I'm gonna go ahead and inject. You wanna make sure that the hub of your needle is all the way into the skin. It should not be hanging out at all, like this, okay? It needs to go all the way in. And then if you're doing it in one of the larger muscles, you need to aspirate. This gets a little tricky, but you can touch the end of the bevel here like I'm doing with your thumb, and then you can go ahead, once you've made sure there's no blood in the syringe, you go ahead and you just slowly inject, okay? This thing has been injected so many times it's leaking out the fluid.
Oh.
Okay. I've never seen that happen before, right? Okay, so I inject it and you're gonna wait, I think it's 3 to 5 seconds. Is it 5 to 10? Okay, ooh, that sounded too little. Okay, 5 to 10, sorry. So 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. All right, now the trick with the Z-Track, you have to make sure that you remove it at the same time you're removing your hand, right? So when you take it out, you do it like this. And you'll see on the other ones, not this one because these ones are old, the other ones literally snap back in place. So it's nice, they actually kind of mimic skin more, but these have been well used, so they don't do that. But, so removing, and if you guys want to watch YouTube videos or whatnot, you can watch that. Yes?
So evidence-based practice, just so you know, because when we teach first semester, we don't aspirate anymore.
Oh, okay, I thought we did on the vastus lateralis.
No,
Okay.
we do the Z-track on the vastus lateralis and the one here. I don't remember the name.
Yeah.
The big one here.
Yeah, so we have the ventral gluteal,
But,
okay.
those we do, but we don't aspirate.
Okay.
Yeah, they've taken us, so it's not
Okay.
even on our validation sheet anymore.
Is it not on there anymore? Okay, because when I was doing it with Marlene before like that, then she had me look up, okay. So stuff always changes, so you don't, I guess you don't have to aspirate, because when we were doing it last time, then they were saying not to aspirate on the deltoid, but
I know.
aspirate on the larger ones. Okay, so you don't have to aspirate.
We don't Z-track on the deltoid.
Yeah, and you
but
don't
we
Z-track, just the larger
we don't
muscles, so.
aspirate anymore.
Okay, so we did the Z-Track, we made sure now we have an open needle, we need to cap this, right? I don't want you guys to be in the practice, I don't like doing this with my hand. I like to usually use, like the bed frame you're gonna have right there, and if you look like, if you push it down and it just activates, right? Okay, because when you start involving your other hand, you're just gonna
Poke
be a
yourself.
risk for poking yourself, okay? Especially when you're getting like checked off by somebody and your first time doing this, you're gonna be nervous, so. All right, so now I'm done with that. I still have my medication to scan here, but this needle can then go in the sharps, okay? All right, my poor guy's leaking everywhere. Okay, and I don't have any gauze. Okay, now the other 2 injections, I can use this pad. All right, so, and again, we already did our 3rd and final check. Now we're just administering the medications, right? So this one is gonna be my Lovenox. So this is just subcutaneous, but same idea, you're still gonna go ahead and clean. Obviously, you're not gonna be doing the Z-Track or anything like that. You're not gonna be aspirating. Start in the middle and move out, okay? You do wanna wait for it to dry, but I'm not gonna wait because I'm gonna be impatient right now. And I wanna show you guys. Okay, so Lovenox, like I said, it's gonna come with like a little air bubble, but our Lovenox, it's like made by us, so it doesn't. But in real life, that air bubble, you're gonna leave that, and that's just like a little air gap to make sure all the medicine gets administered to the patient, okay? So we're gonna go ahead, you can just kind of pinch the skin a little bit just to hold it firmly, and then you're gonna go, depending on how thin or not thin your patient is. Most people, if you can pinch an inch, then a subcutaneous needle going in at 90 degrees is fine. Obviously, if you have somebody that's very lean and has no fat, you may have to do like a 45-degree angle. Otherwise, you're gonna be going in not subcutaneously. It's gonna be like I am for that person. So just make sure, depending on that they have enough subcutaneous tissue in order to tolerate going in at the 90-degree angle, okay? So we'll go in and then just straight in, and we wanna make sure that the hub of the needle goes all the way to the tissue or to the skin. It shouldn't be hanging out or hovering. And then you're just gonna slowly inject. All right, and then you're gonna wait your 5 to 10 seconds, and then you're gonna remove, okay? After 5 to 10 seconds. Again, you wanna activate the safety needle, and then I just like pushing it against like a hard surface, okay? These ones are a little trickier, but you just have to practice with them because these ones locking are a little more funky, so. All right, and then I can throw that away. The last thing is gonna be your intradermal injection. So we're gonna be doing that, we'll do that on our little sub-Q guy. So I would get a new alcohol wipe. And obviously this is gonna be in a different location, right? Where should an intradermal injection be? Yeah, forearm, right? And then when you do the intradermal injection, you're gonna be doing bevel up or down? Bevel up, yep. And you should see a, yeah, right, your little wheel, and then you're gonna mark that area of the skin, right? So I'm now on the patient's forearm area. I have my intradermal injection, my PPD skin test. I'm gonna do bevel up. All right, let's see. All right, and you can kind of hold the skin and put in. I don't know if I'm gonna see how I can. Oh, I popped my bubble. Oh no. Okay, sorry, don't be like me, okay? Here, let me go a little deeper. All right. And there's my, I hope I don't pop that one. Okay. All right. Oh my gosh, that one popped too. Okay. Sorry, these are well used, so sometimes they're a little fluid, like little volume overloaded. But you basically just practice getting that, make sure your bevel's up. You should see the wheel. And then we don't have to do anything with the wheel, right? But we do need to activate our safety needle. So this one just pushes up to cover your needle, and then you throw away, okay? So we're done doing our injections. She didn't need, if she needed a Band-Aid or was bleeding at your IM site, you know, you could do that. Otherwise, on your intradermal area, you just want to mark it with the pen. Shouldn't need to do anything with the sub-Q, the IM. If it needs a Band-Aid, you could put one on there if they were bleeding. If they're not bleeding, you don't have to put it on there. Now we need to do our, what documentation do we need to do, right? We need to document and scan all our meds, right? So we need to make sure that we have these scanned in, and then you're gonna save them electronically like on your MAR, right? So typically what I do if I'm giving meds like at a patient's bedside, as I'm doing my third and final check, what I like to do is like scan it right then, and then I leave that, and then after I'm done giving the meds, you push accept. Does that make sense? Because what if you drop the needle or something on the floor and you have to go get another one or something? You don't want to accept it until you've actually given the medicine, okay? So your last thing is the right documentation, right? So we've done that. Okay, now we're going to assist the patient to like a comfortable position, because maybe we sat her up to give the medicine or laid her down to give the sub-Q or whatnot. So we'll get rid of all your stuff. And then what do we tell the patient? Is it 2 hours?
72. I thought it was after certain medications you come back to check on.
Yes.
To see how they're
So what
tolerating.
medicine do you think should be checked back up on?
Well, she had morphine or anything.
Morphine, right? And why would we check up on morphine?
Because we want to see how the medication is effective and how her respiratory
Yes.
and vitals are doing.
Yes, so just like on the checkoff on here on the back page, so we'll take off our gloves. Let's pretend I have a trash can here, which I don't. And then, so take off your gloves, hand hygiene again. And then you're gonna tell us, okay, I'm gonna return within 30 minutes, thank you, to evaluate the response to the medication, to make sure the pain medicine was effective, to make sure that they didn't have an allergic reaction or some kind of side effect, right? Maybe they have an allergic reaction to something. If you're giving meds, they can, so you have to check back on them. So I want you guys to verbalize that. So you'll verbalize, you'll take off your gloves, you'll do your hand hygiene, you'll explain to the patient that you'll be back within 30 minutes to check on them, and you'll explain to us what you're looking for that, okay? Like the signs of reaction or whatnot, and making sure that it's effective. The other thing that you should do is make sure that, let me see, we talked about recording it on the MAR. Okay. How the site, I mean, it should look fine at first. If they're gonna have a reaction or something, that's something
Maybe
that would
later.
probably develop. That's why you wanna check back in like 30 minutes or so, right? What else? Anything else? I think that's it. Like, and then just say, make sure they have their call line in reach, assist them to a safe position. And then, like I said, for the checkoff, at that point, after you guys like do that stuff and you give your meds, then I'll say, okay, show me where your 3 injection sites would be. So I'll have you guys do that, and I'll have you model it on us. Okay? There's mud. All right, hopefully, I think we went over all this stuff. Again, just practice with the aspirating out of your glass vial. I think people tend to get nervous with that. Make sure you're practicing the Z-track method. Make sure you know your anatomical, I want you to tell the landmarks for the IM, yeah. What's funny,
What specifically do you want us to say for each one?
like, if I,
On the landmarks, like what we're telling you.
oh, okay.
For this.
So on the modules, so let's say you're saying your deltoid.
The deltoid.
Yeah. So deltoid right here, right? So in this diagram here, we have the acromion process, right? So I want you to say, I'm palpating for the acromion process, and then I'm gonna do 2 to 3 finger breaths down from that landmark, and this will be my injection spot. So if I said, you know, doing 2 to 3 finger breaths down,
Yeah.
and then this will be my landmark for injection, right? That's an easy one.
It's
The
because
vast,
that's the one. Yeah, that's the one that's not. It's because she said, "Why does yours have 4? They have 30."
Oh.
Because we no longer do the dorsal gluteal, right?
you know what's
Okay.
crazy? My check also says about aspirating, so maybe I just need to print out the new one.
a new one.
Okay, thank you.
Oh.
Okay, because I'm like, it's not that. Okay. All right.
For
So,
this one, it's anterior superior unit.
yes. So that is for the dorsal or ventral gluteal, right? So the ventral gluteal is that one where you're going to have to palpate, and you're going to need to do, like, if you're doing it on the right side of the patient's body, you need to palpate with your left hand. It's like the opposite. Yeah. So just make sure, just like the diagram shows, and you would say, I'm going to be palpating for the iliac crest, and then I'm going to put my, pointer finger towards the anterior superior iliac spine, like, which is basically towards the belly button is where you want to angle it to. And then you're going to show me where your target area would be. So, and that you really need to fill in on people, because when you first start doing it, you're going to feel like bone. And obviously we don't want you to inject on bone. So you need to just kind of get comfortable with it, because you're trying to look for like that soft spot of like muscle to give that injection, right? And then when you do the vastus lateralis, you need to say, okay, we'll be standing up for you, or I mean, we could sit, whatever. I think standing is easier for the ventral gluteal. But for the vastus lateralis, you're going to say, I'm going to be palpating for the greater trochanter of the femur, and then I'm going to be looking for the lateral femoral condyle. Like, those are your 2 bone landmarks,
Yeah.
right? And then you're going to say, so, and when you find those 2 like sections, you're basically dividing it into 3, right? Like when you're looking for that landmark on that leg. So then you're going to say, okay, so my point to go in would be here. So you're just kind of giving us like, showing us where that muscle injection would be. Okay? That makes sense? So just, they're not hard, it's just memorization, but I do want you guys to know the landmarks, okay? I want you guys to make sure that you're doing the 3 checks. Again, when you're validating your MAR, the very first step, that's not a check. Make sure you're doing the 5 rights. It's actually 7 rights, but remember that paper that has the reason or indication is your 6th right, and then your 7th right is your documentation, which comes at the very end with your 3rd and final check when you're scanning your medications and getting ready to give those. That's when you're doing that documentation. You're not doing the documentation every time that you're doing a check, right? So, okay. All right, you guys ready? How much time do we have? Like at 45 minutes or so to practice? So you guys can come up, you can use this one. And I'll put these things in here. Feel free to break the little glass ampules if we need more, that's fine. I do want you, hi.
The back